And Senator Bernie Sanders has been hospitalized and treated for a heart condition. His staff has canceled all scheduled campaign events until further notice. Sanders, who is 78 years old, was in Nevada when he experienced chest pains. After seeking medical evaluation and testing, it was discovered that he had a blockage in one artery. 2 stents were successfully inserted in surgery today. He is said to be resting and in good spirits. Now, to give us some understanding of what Bernie Sanders is facing, we're joined by Dr. Stephen Reisman. He is the director of the New York Cardiac Diagnostic Center and the author of numerous publications and original research. Good to have you with us, Doctor.
Nice to be here.
All right, Dr. Steve, I realize that Bernie Sanders is not your patient, but from what you understand, what is the likely recovery time after a procedure like this?
So the recovery time depends on how many blockages there are besides the stent that was put in. We don't know the other 2 or 3 major coronary arteries if there were severe blockages there. He is 78. He could have blockages also in his carotid arteries at a stroke risk. So all these things should be evaluated to determine risk. Generally speaking, if a stent is successful, you'll have complete revascularization and you'll undergo testing afterwards to see how you're doing.
But how serious is this procedure that he had done?
It was an emergency procedure. There's no doubt about it because he even tweeted it was something about an emergency procedure. He had chest pain, I think, on Tuesday evening. And within 24 hours, it sounds like he had an angiogram and he had the stents placed. So I think a lot of the information has not been released yet. We don't know if he had a heart attack or he didn't have a heart attack. The campaign or his office should really release a lot of that information.
If he was your patient, what would you advise in terms of recovery, in terms of rest, in terms of his schedule?
I think if he was my patient, we'd have to consider terminating the campaign because there's a lot of stress and anxiety in the campaign.
Sure.
Stress is a risk factor for coronary disease. And, you know, we have to know how severe and extensive his blockages are. We don't have that information. So sometimes they might have put a stent in the most severe artery, and there could be 2 others that also have severe blockages. We don't know that information, so we're a little bit at a loss right now to know what to really predict and how to fashion his recovery.
In terms of complications from this kind of surgery, can stents cause blood clotting? I mean, if he does resume his campaign, I imagine there'd be a lot of travel involved. That's a lot of flying on airplanes and certainly a lot of stress. Could the procedure come with certain complications that would be exacerbated by a tough schedule?
Well, stents are relatively harmless these days. Not harmless, but low risk, meaning. So depending on what type of stent he had, he may have had a stent that requires blood thinners for a certain amount of time. We have to make sure he's not at risk of bleeding. But normally stents have a very high success rate. Normally after the stent, if that's the only blockage, one might consider doing a stress test in a few weeks to see how he's recovered and how he's doing.
In terms of regular people, I mean, he flagged this, he felt some symptoms, we understand, and there was some preventative measures being able to be taken successfully. What are the signs that people should be looking for?
Well, he had one of the typical signs. According to what I read, he had chest discomfort or chest pressure, and he was then evaluated quickly. But there are many symptoms that one can have before they have a heart attack or angina. Can be chest discomfort, can be indigestion, can be shortness of breath. In women, it can be atypical, severe, fatigue that's not usually there previously. And of course, there are risk factors we have to consider: diabetes, high blood pressure, high cholesterol, smoking, family history of early heart disease. And stress is an issue. Of
course, I'm sure stress is a giant issue. All right, thank you so much, Dr.
Nice being here.
Reisman.
Thank you,
Appreciate it.